some of the epilepsy patients, in the sense that it can be due to a difference in where they were born, how the brain was formed. Also, sometimes in some of your problems that you have with channelopathies and how messages is passed, especially the messages are passed from one cell to another or over a cell membrane. And then it's very important in specific syndromes, because there's quite a few syndromes that we know where the patients will present with epilepsy or with epileptic features, but has a clear pattern of autism, but has other issues that would fit in with that then. The incidence of epilepsy in autism is 25%, which is 10 times more likely to happen than in your neurotypical population. If you have an intellectual disability with autism, you have a 21% chance of getting epilepsy. Whereas if you're high functioning with no intellectual issues, it's only 8%. Age of onset can be any time. And what is interesting, if you look at epilepsy, is that there's in autism a group of patients who only start in late teens or early adulthood with epilepsy, which is not a common time for epilepsy to start without having other problems like having been in an accident or having had some form of trauma. Other neurological problems also leads to a higher incidence. For instance, if you have structural lesions as part of your clinical features, you have autism, you have a much higher chance of having epilepsy too. The same with patients with cerebral palsy that also has autism. Does epilepsy cause autism? No. What you do find is that there's a higher tendency to autism traits in epilepsy patient, but it's traits and not necessarily the full diagnosis. That's where that realization comes, that the patients can have psychosocial issues. But in patients with the continuous slow wave sleep, yes, that can give them a picture which really makes them look autistic. And if you treat them, a lot of those features will disappear, but some of them will still have enough to have a diagnosis of autism, and some of them will have quite a lot of autistic traits. But at this stage, there is no pattern or form of epilepsy where the epilepsy causes the autism specifically. I've put in here, we talk about neurodiversity, and one of the issues that we often get in epilepsy patients is ADHD. We know that ADHD is much more frequent in epilepsy patients. Normal percentage 4 to 7%, epilepsy patients up to 28%. Problems with concentration and focus in your ASD patients, much higher, even up into the 60%. Then these patients known with EEG abnormalities, and there's an increased tendency to subclinical abnormalities, which means that if you do an EEG, you do get changes, but the patient is not having clinical seizures that anybody is aware of. But this tends to happen more in patients with autism that has a lower intellect, that has more serious dysfunctional behavior,